there are more and more young people with heart problems, and I think that is due to our lifestyle. As a country becomes, or we become richer and richer, the food we eat becomes not as good as it was in the past. More sugar, more oil, etc. And then we also do a lot less exercise than people of 100 years ago. So these reasons make us more likely to get heart disease, and also at a younger age. We do see a lot of patients who are young, and coming to the question of when to screen the patient, that means when do they first start coming to us for a test. Now, if it's somebody with no previous past history and his family has also no past history, then the recommendation is that for them to have a screening at about age of 40 years old. And the screening is a simple thing. You don't have to do a lot of tests. You just need to do some blood tests to look for diabetes or high cholesterol. We examine them to make sure the blood pressure is normal. So the three important risk factors, which is diabetes, high blood pressure, and high cholesterol, can be screened quite easily and at a very low cost. Especially for male at 40 years old, then I think it is also quite reasonable to do a test like a simple treadmill stress test to stress the heart to see if there's any abnormality. In a young patient with a sudden death, there are many reasons. Of course, the commonest reason, again, is heart artery blockage. And that may cause a heart attack when they're exercising and then lead to a death, or they may need emergency angioplasty or heart bypass operation. There's also a condition where some of them have abnormal heart muscle. That means they are born with this condition where the heart muscles become abnormally thick, and they may experience a sudden death or near sudden death during exercise. And we've read about sportsmen who are playing basketball and they're very well 1 minute and suddenly they just collapse and die on the court. They may have something, a condition where they are born with the heart muscle being too thick. And the last but also quite rare condition where some of these young people can have is they have an abnormal heart rhythm. That means the conduction is an electrical conduction abnormality. And again, that is born with it and cause some of them to have this sudden death while exercising. In a young patient that we see, if from a screening, we do blood tests, we check their blood pressure, we do a simple ECG, which may pick up some of these electrical problems, and we do a simple treadmill test, we can actually pick up quite a lot of problems already. And if they have previous family members with heart disease, then the recommendation may be that to do the screening as early as age 35, so a bit lower than age 40 for a male. For a female, because they tend to have the heart disease later, they could wait maybe another 5 or 10 years before they actually need a screening.